colleagues. My name is Dr. Diana Canto-Sims, owner and founder of Buena Vista Optical in Chicago. And today we are having a conversation I wish someone had put in front of me when I first started in my career, because finding the perfect ophthalmologist you can truly trust with your patients is one of the most important decisions you will make in your career. As optometrists, we work so hard to build trust with our patients, and the moment we refer them out, that trust is either honored or it isn't. So let's have a conversation about this. I'm joined by Dr. Kovach, and we're going to talk about two things: how to find an ophthalmologist you can truly trust with your patients, and how to make your referrals so good that your patients and your ophthalmologist partner feel it. This is the kind of conversation that changes how you practice. So let's get into it. Let me introduce today's guest. Dr. Kevin J. Kovach is a board-certified comprehensive ophthalmologist with more than 30 years of clinical and surgical experience serving patients throughout Chicago and the greater Chicagoland area. He is the founder and medical director of Kovach Institute and owner of the Ophthalmology Surgery Center of Illinois. He is recognized as a leader in advanced ophthalmology with expertise in cataracts, glaucoma, refractive surgery, and the comprehensive management of complex eye conditions. And here is what makes him especially remarkable. Dr. Kovach is one of the first surgeons in Illinois to perform SMILE LASIK, the EVO ICL procedures, introducing some of the most advanced vision correction technologies to patients across our state. Dr. Kovach, welcome, welcome. We are so glad to have you here today.
Thank you. Appreciate the opportunity to share our thoughts.
So let's get into our first topic. This one is for every optometrist watching who has ever wondered, am I referring my patients to the right person? What questions should an OD ask an ophthalmologist directly when they are first building that relationship?
Obviously, quality of results are imperative. Patient experience needs to be 1A as far as being able to deliver the same sort of experience that the optometrist has developed with their patients. And adaptability to technology and implementation to their care, the patient's care, to optimize their results.
So when I refer my patient to an ophthalmologist, I need to know that they're going to come back to me, right? So what signals should an OD look for to know that an ophthalmologist will honor that relationship and not absorb their patient?
There should be communication, obviously, from day one of the handoff of the patient for the referral and co-management. There needs to be an understanding. We have a manual that our optometrists that refer to us utilize. They understand what to do with their care, when the handoff, when should they refer, and then there's an understanding as to when the ophthalmologist is at day one, week one, that the patient will be transferred back to the optometrist for the continued care. There needs to be an understanding as to under what circumstances does the ophthalmologist need to get re-involved with the care. But as far as signals as to making sure that the patient is transferred back to the optometrist care, there should be a team, an organized system of communication and notes that are shared. We have a sophisticated portal system that many of our optometrists use. There's other ways to accomplish this via HIPAA compliant faxes and emails. But communication is key. And there should be a team on the ophthalmologist side that facilitates that communication back to the optometrist and the optometrist's office. And there should always be an understanding that the optometrist and the optometrist's office can contact the ophthalmologist if there's any questions regarding this transfer of care.
You mentioned co-management, and that's my next question. So co-management is where a lot of OD MD relationships either thrive or fall apart. How should an OD assess whether an ophthalmologist is truly a co-management partner before they ever make that first referral?
Well, I would interview the doctor that I work with, just like I interview the ophthalmologists that work for us. I think the optometrist should interview the ophthalmologist and ideally observe some cases with the ophthalmologist so they understand how the surgeon performs the care, and then communicate, during those encounters what the expectation of the optometrist is to the ophthalmologist. And a lot of our optometrists work on different levels of comfort level of co-management. Like I say, a lot of our optometrists are very comfortable doing day one post-ops, but many are not. So we as ophthalmologists need to understand where that comfort level is and how we can basically serve the optometrist's needs to make sure that the patient's care is perfect throughout their adventure of medical or surgical care.
So, if an optometrist is watching this and they realize that they never truly have taken a close look at their current referral partner, like you mentioned, right? They haven't maybe interviewed them or had a conversation with them. What is the first step that you would recommend they take this week to evaluate or strengthen that relationship? And something that I want to share is I remember when I first started our practice, we had opened maybe a week ago, and an ophthalmologist drove by and said, "Oh, you're new." He said, "Here's some business cards. Will you refer all of your cataract patients to me?" And then he walked away. And I thought that was a strange encounter because I thought, well, maybe we should sit down and have a conversation. And then on another occasion, I remember I sat down and had like a 2 hour conversation in the office. And then I never heard from the ophthalmologist again. I even tried to refer some patients and I didn't hear anything. So, what would you recommend would be the first step to strengthen that relationship?
Well, talk to colleagues, number one. They can share their experiences with the said individual, and you can get some understanding there. But there needs to be personal rapport always between the doctors. That trust factor that you speak of is super important, and to have trust, you have to have communication. And if ophthalmologists won't uh, communicate directly or through staff in a very organized fashion, then the care will be compromised, and that would not be a good thing, right? So I have a whole team of liaisons and patient educational coordinators that help me communicate with all of our optometrists and offices, because obviously if I'm in the operating room working on people, I sometimes can't answer a text or return a phone call immediately. So I have a whole team of specially trained staff that whose job is to communicate with the optometrist in the office. Let them know what was done, when it was done, what type of procedure. Are there other things that need to be looked at with a particular patient, and continually communicate those issues back to the optometrist's office. And if an ophthalmologist isn't, giving you their phone number or their email or their staff's information, then communication cannot happen, and then
Right.
patient care will be compromised. So that's imperative to have
Right.
that direct communication.